Thank you very much, Mr. Chairman. Chairman Adolph mentioned a few issues, one in particular regarding the zeroing out of certain line items, and you were not adverse to adding back that funding, but it may require a fair degree of negotiation. And I just want to echo the Chairman's concern and support for the diabetes, lupus, epilepsy, ALS, poison center, control centers, very, very important throughout the Commonwealth of Pennsylvania. And I'm hoping that the Appropriations Committee in the House and the Senate and the health committees can come together and find a way to restore that funding. I noticed in the highlight of the budget proposal that you have, and I'm very thankful for this, $1 million to provide an additional 24 loan repayment awards to recruit and retain healthcare professionals in underserved areas. This is a very, very important issue. I wish we could even do more, but it's a good start. So I want to commend you for that. We have serious problems throughout the Commonwealth in providing medical professionals for underserved individuals, and the quality of care suffers when we do not provide those opportunities for people to get treatment. So that I want to commend you for that. But underneath that, it also mentions providing $4 million in grants to healthcare clinics to increase access to preventive primary care services for uninsured individuals in those underserved areas of the state. And that, again, is a very, very good idea, but I would like to have clarification in terms of how that's going to work. Is that going to be for just certain types of health clinics? Is it going to be applicable to only federally qualified health clinics, look-alike health clinics? Could you give me some clarification as to what kind of level playing field health clinics throughout the Commonwealth may or may not have in terms of accessing that $4 million?
Certainly, Chairman Baker. It is our intent to use the money as judiciously as possible. We recognize, too, that there was a considerable legislative effort last year surrounding this issue. It is our intent to work with the legislators again, the legislative body again. We have put forward some language there. As you are aware, Senate Bill 5 has been reintroduced. We have put forward language. Our primary care, the loan, excuse me, not the loan repayment program, the healthcare clinic monies that we have been doing, as you know, have been going to both FQHCs and non-FQHCs. And quite frankly, I believe it's over the past 5 years, we're literally almost at 50-50 as it relates to who receives the funding. So we believe it's very important for us, and I think one of the other areas that we're excited about this money going into is the mental health arena as well. So we recognize that mental health, particularly in underserved areas, is a very significant issue, and one that we look forward to working with the legislators and quite frankly figuring out how we best utilize this funding moving forward.
Do you have a model that could clearly delineate how the money is going to be, what the process is for accessing the $4 million?
I think what we have done, as I said, we have shared legislative language. I believe we've shared it with you. If not, we'll make sure we share that language with you and your office moving forward. And it is our intent, what we had put forward is something that looks an awful lot like our current program, where it's monies that can go to multiple locations.